Hey everybody, it's Dan with Pain For You. Got a little chilly morning, so I got the hat on again, but as you can see, I'm growing my little gray beard here. First, before we begin, I would like to tell you the topic, which is, it's not structural, okay? And so, before I start, let's take a couple of deep breaths. Just breathe in the health. Breathe out the stress. Feel your feet on the floor. Breathe in the health. Breathe out the pain. Breathe in the peace. Breathe out the chaos. So again, the topic for today is it's not structural. So I can't tell you how many times I get messages, I hear from people, I get emails, private messages, and people ask questions that lead me to believe that they truly don't understand that what's going on with TMS. And again, TMS is the brain creating pain to distract us from our overwhelming negative repressed emotions. And there are some theories that TMS, or this pain, comes from a reaction in the body and the nervous system to a vast amount of stress, unresolved stress, an accumulation of these repressed emotions that somehow unloads into the body. Look, however you view the pain, I will tell you that it is not structural. The reason I know that is because hundreds of thousands, if not many millions of people have gotten better with Sarno's work. And our bodies are not perfect. We have bulges, we have herniations. 2/3 of the population with no pain have bulging and herniated discs at one or more level. Degenerative disc disease, which isn't a disease, it's called aging. In our 20s, a certain percentage of people, I don't know, somewhere around 20-something%, but in our 30s now, like 30% have it. In our 40s, like 60% have it. By our 80s, like 90% of the people have this degenerative disc disease. It just means we're aging. That doesn't mean that's the cause of the pain. So many people will ask me questions that lead me to believe they don't seem to really understand TMS, and if they do, they're kind of dismissing the fact that it's all created in the brain. We feel it in the body. The pain is real. It's not imagined. But the body is not causing it. Look, if you cut your hand with a knife, you will feel pain. You will see where it happened. Everything else that you're feeling, for the most part, most of these symptoms are created in the brain. There's no physical damage that's the actual cause. Now, where people get confused is they'll hear in some of the Facebook groups, rule out the physical. So they go to a doctor and the doctor goes, oh, look, you've got a bulging disc. There it is. And the whole TMS concept goes out the window and goes, oh my God, it is physical. It is structural. No. These bulges and herniations are normal abnormalities, as Dr. Sarno called them. And the reason we know they don't cause pain is because when somebody completely embraces the TMS concept and the TMS approach to ending their pain and symptoms, the pain goes away. Now, some people actually believe that the mind, that the TMS approach of feeling our emotions somehow heals these bulging and herniated discs. No, again, that's not how it works. And we don't need to heal these bulges and herniations to get rid of the pain because they were never the cause. So anytime people get surgery or injections, the doctors are treating the symptom, not the cause, which is why, invariably, most of the time these physical treatments don't work. Now, I just got a message from a gentleman who's talking about a discogram, and no offense to this gentleman, but I don't believe he understands TMS yet. Because he was saying, well, if somebody has TMS and they inject dye into the disc to see where it's hurting, why would that hurt when they do that? And my answer was pretty simple, because you just had somebody jab a steel needle into your back. Of course that's going to hurt. And let's just talk about the medical discovery process. I mean, I don't get the concept of injecting a piece of steel and injecting dye with whatever chemical compounds are in there into your spine or into your disc. How can that possibly help us? So, I don't know. I look at some of the mainstream medical treatments, especially things like nerve ablation, where they will literally like burn the nerves. It just blows my mind that these are the medieval type of treatments that the doctors are attempting to use to end pain, when in fact the vast majority of pain is TMS. It's mental, and I'm not calling you mental, but it is mind created to distract us from our overwhelming negative repressed emotions, and also the emotions that don't fit with their self-image. So it is not structural. And I talked to another gentleman who, has worked in the medical field, and he has been taught and actually practices the mechanical model of the body as, the cause of most pain. And he's going to physical therapy, and he's doing this, and he's doing exercises, and he's, extremely embraced the mechanical model, because that's his profession, that's his knowledge base, that's his worldview. And he emailed me last night and said, I was doing pretty good, and I had almost no pain, and at one point no pain, but then I did this, and the pain came back, and so I don't understand it. And then he actually went to a doctor who supposedly knew about TMS, and the doctor called him a hybrid. Well, you have TMS, but you also have physical problems. I don't get that. And I know somebody else who had a visit with the doctor and was told it was a hybrid also. I don't get that. How does this doctor who supposedly knows about TMS say that the structure they see is causing the pain, but yet TMS is causing the pain? My opinion is it's one or the other. And invariably, most structural problems are not problems. They're just abnormalities. And so I get a little bit frustrated, because the first concept I teach is knowledge. You really have to understand TMS in order to get better from this and eliminate the pain and the symptoms. If you don't understand that the brain is what creates the pain and it has nothing to do with the structural, you're going to have a really tough time, because you're always going to be looking at, well, I did this move, I bent over, or I did this, or I walked up a slope and the pain came back, and I don't understand, this isn't working because I'm doing the TMS approach and it's still not working, so it must be physical. Well, if you're not embracing and accepting the fact that this is 100% created in the mind and has nothing to do with the mechanics of the body, then you're not following a TMS approach yet, because you don't understand TMS enough to realize that the body is not the problem. And so, if I'm sounding a little frustrated, it's because I can be sometimes. And it all goes back to the core foundation. You've got to understand TMS. And so if you are questioning, I did this, I moved that way, or, this happened, so it must not be TMS, I will encourage you very strongly and with love to go back to the beginning and learn about TMS. If you don't want to spend 6, 8, 10 hours reading a book by Dr. Sarno, there's a 20-minute presentation at painfreeyou.com. It's a video I put together, a little PowerPoint presentation that just kind of walks you through it. So, if you are still saying it's mechanical, it feels mechanical. Talked to a lady the other day who said, I think she's got Ehlers-Danlos syndrome. And, that is hypermobile joints, right? The tendons and ligaments are much more flexible and mobile than the vast majority of people. And there's a whole community of people with Ehlers-Danlos syndrome that have pain. as a result of this? Well, fortunately I worked with a young lady who, when I met her, she was in a neck brace. She could not lift her arms up enough to even feed herself. And after several weeks of working with her, she was able to start getting her life back. I think 6 months later, this lady who was in a neck brace, actually the neck brace she was able to lose in a few days. Her arms she was able to start using in about a week. 6 months later, this young lady was rock climbing. Now this is somebody who couldn't raise their arms up above their shoulders, and now she is hanging from a wall on these little artificial rocks in a gym and climbing a wall, a rock wall. And so even things like Ehlers-Danlos, which is a real physical condition where the joints are hypermobile, what ended up happening was this girl felt like a lot of things were dislocating. I believe it was because TMS was causing the muscles not to work as they should, and if they went into spasm, something could pop out. And so muscle spasms and tightness and tension is a fairly common TMS condition. And so I was all jacked up, and I've mentioned it. I had pain twice in the past year, both absolutely as a result of mind-body emotional stressors. And when I had pain, I got a little bit crooked, right? Because my lower back tenses up, which kind of pulls my hips out of alignment. And so when I would stand on a flat tile floor, it literally felt like the floor was uneven, which was bizarre, but that feels physical, but it's not. The tension, the muscle spasm, the out of alignment is not the cause of the pain. It is the result of TMS, right? And so, this is not structural. This is not mechanical. TMS is as a result of too much stress. And if you are still questioning, well, this feels physical, so maybe I don't have TMS. Foundation 101, TMS 101 is knowledge. What the hell is TMS? How does it happen? Learn about it. Read Sarno again. Watch my presentation at painforyou.com. Please understand that the brain creates the symptoms. It's not the body that's causing the problem. And a number of people are still struggling with, well, I did this movement and the pain went up, so it has to be physical. Let me remind you, when the brain perceives there is danger, the brain will turn up or turn on the pain. So watch that video, danger versus safety, right? You can find that YouTube. Go to the Pain For You channel and search for danger, and you will find that video. But basically, the brain elevates the pain when it perceives it needs to protect you, because it believes, and you believe, that this movement is dangerous. Bending over is dangerous. And so the brain goes, here's some pain, don't do that, don't do that, that's dangerous. And so there's a lot of this that comes together, but please, if you are still believing this is a mechanical problem, I will challenge you to say you probably don't completely understand TMS, or even if you do understand it, you don't believe it applies to you. So Foundation 101, TMS 101, remind yourself what the mechanisms are of TMS. It is created in the mind to protect you at first from the emotions. And once it kind of takes hold, and the fear takes hold, and the focus and the frustration and the fixation on the pain, the brain now seeks to protect you from movements that it has learned incorrectly are dangerous. And so that's why movement and exercise and things like that can cause the pain to spike, because the brain is in the place where it's still trying to protect you. So I will remind you of the I'm good technique. So if you struggle with movements, right before you do it, I'm good, and go. Right? I know that seems weird and simple, but it's worked for me a lot towards the end of my pain journey. So if you have moves, like you got to get off the couch, or you got to get in the car or whatever, and you know that that's hurt you before, it's called a conditioned response. But one good way of sending a quick signal to the brain is to say, I'm good, and then take the move. Because you're sending that message that says, I got this, I'm good, don't worry about it, right? So I love that technique. And for anybody struggling with the mechanical concerns, try the I'm good technique. It's not instant. It takes time, takes practice. The brain is a little bit slow to learn sometimes. So some people also conclude that, well, I tried what you told me, Dan, and it didn't work. So, it's kind of BS. This isn't working for me. So it takes a little while for the brain to unlearn that things are dangerous. So with consistency, and here's where the mindset comes in. You make a move and it hurts, don't care. Just say, all right, I expected that, no big deal. I've lived through it before. I lived through that one, So listen, guys and gals, it's not structural, it's not mechanical. It's all as a result of the brain's desire to protect you. And it's a misinformed strategy by the brain, because really these emotions weren't dangerous. You just think they are. And even if you don't consciously think they are, if you look back at your emotional history, we've often learned and been taught by parents, by the people who brought us up, who raised us, that certain emotions are not allowed. And so we resist them, we push them away, and even subconsciously, outside of our awareness, our brain just locks them up, because we have learned these emotions don't belong. And that's evident by the number of people that say, I don't know how to feel my emotions. So my simple answer to that, and it's much more complex, my simple answer to that is, have you ever been pissed off? Do that. Have you ever been sad? Do that. Have you ever been feeling guilty? Do that, right? And so let's not make this out to be more than it is. Feeling our emotions is not that complicated. I think it's not a matter of digging for them and looking for the emotions or forcing the emotions. I absolutely believe it's a matter of allowing. Allow yourself to feel whatever you're feeling, whatever that is. Give yourself the gift of feeling these emotions so that they can pass. Because if you keep pushing them away, they're going to keep wanting to come in. So allow yourself to feel them and they will pass through. So listen, it's not structural. I love you guys and gals. I'm not frustrated with you. I'm frustrated for you. And I'm frustrated like you are. I'm sharing your frustration. But I'm really just trying to make sure that these messages get through, and that you completely buy into the fact that mechanically, structurally, you're actually okay already. And so if you can buy into that, if you can kind of reinforce the knowledge side of this TMS equation, that's going to carry you very far into the rest of the process. So with that, I do love you. I always want the best for you. Like I said, if you're not confident that you can get better, let me carry that confidence for you and that belief for you, because I do, with all my heart, believe that we can all get better. We can all get past this. If I can do it after 13 years, you can too. And trust me, I would not be spending my time shooting these videos every single day for a year if I did not truly believe that this is the answer to chronic pain. So I believe it's the answer for you. I believe it's the answer for all of us. So you can get better. I did. You can. So many people are getting better. So don't give up. And if you got a comment here, let me know what you think. If you're still on the fence and you're still stuck with this whole mechanical, maybe it's physical, go back to the knowledge. Really understand what Sarno taught. And what the other experts have been teaching for years. So, love you guys and gals. It's not structural. It's not mechanical. It's all TMS. Too much stress. So, talk to you soon. Love you.